back to the show. We're going to talk about everybody's favorite, and that is going to the dentist. Better yet, what if the dentist comes to you? I've always had a great experience with dentists, but my next guest has a really unique experience because she has a mobile van that comes to you. I am joined by registered dental hygienist Shannon Maitland and owner of Complete Oral Wellness. Welcome back.
Thank you. Thank you for having me back again. On this segment, I just want to reintroduce myself to everybody. My name is Shannon Maitland. I'm a registered dental hygienist. I'm a dental hygiene educator. I've been a dental hygienist for 15 years.
Wow.
I left working private practice for a dentist. I started teaching, and then I opened up my own independent dental hygiene practice.
Right.
Now, hygienists, we have our own regulatory body. We are allowed to practice independently, and there's a couple of ways we can do that.
Okay.
We can be a home base where we can have a clinic set up inside of our home. We can have a storefront. We can be mobile. Mobile being like long-term care facility where the hygienist will bring in their equipment inside. Or like for me, you can have a mobile dental hygiene van. So I have a ProMaster, a Ram ProMaster that I've outfitted the inside of the van with a dental clinic.
Yeah,
so
you sent us some pictures too. So if we can bring some of those up as you describe. So I mean, who's your regular client? Like describe the demographic you most work with.
So overall, probably general population. Now it's kind of like it's Amazon Prime for your teeth, right? Because everybody wants that convenience and that accessibility. So families, busy moms, because I can come to the house and then you're not having to bring all these children into the office. You can entertain your other children inside your home. Or maybe there's people who don't have transportation.
Right.
So that's a big thing. Limited mobility is a big thing. Our senior population as well. And having a mobile dental hygiene van that will come to your home, or it could be home, it can be school. I've met a mom at the child's school.
Really? Oh, that's amazing.
Construction sites. So there's all these wonderful things. And now we have our new Canadian Dental Care Plan.
Yeah, tell me about that. So how does that impact Canadians, and how does it probably doesn't, does it impact you in any way?
It does impact me. So I am a registered provider for the Canadian Dental Care Plan program.
Okay.
So 1 in 3 Canadians have financial restrictions that limitate them from getting dental care.
Right.
And again, we have 1 in 3 Canadians that also have periodontal disease. So it equates to the math that there are 9 million Canadians that do not have dental health care right now at the moment.
Right.
So it's going to help bridge the gap for Canadians who don't have access to dental care benefits, who file their taxes. So right now, anybody over the age of 70 can apply. And coming June 1st, anybody with a taxable disability benefit and children under 18 will be able to apply. And then the remaining population will be able to apply January 2025.
Yeah, and I think it's incredibly important because, anything that goes wrong, in your mouth, orally, it affects the rest of your body. I mean, we're talking, this is a big deal for those 9 million Canadians. You've got a 1-year anniversary coming up, right? What have you got planned for the anniversary?
So for our 1-year anniversary, we'll be at the Carleton Place Farmers Market. I'm planning a free oral cancer screening, as well as I'm giving away this water pick. So if you come and get an oral cancer screening, you can have a chance to enter into the raffle to win this water pick Aquarius.
Amazing. You're going to give me a screening today,
absolutely.
Right? Okay, I'm going to come sit over here. This is the things you do as a live television host. You just you put your trust in people. Don't be frightened over there, Karen. Shannon is an absolute professional. See, people hear dentist and they get scared, Shannon. I don't know why. I've never had a bad experience
and
at the dentist.
And I wake up this morning and I'm like, Derick, would you like to have a free oral cancer screening on the show today?
And I'm like, sure, why not? Let's do it.
Okay.
So it's fairly quick then.
Yeah,
right?
It probably takes about 2-3 minutes to have an oral cancer screening done by your healthcare professional.
Okay.
Now, it is the standard of care. It should be done at every examination when you go to the dentist.
Okay. So if your dentist isn't doing it, you should ask for it.
Yeah,
right?
advocate for having a screening. Again, independent hygienists, we have a little bit more flexibility in our schedule as well.
Okay.
I'm going to go ahead and touch you, okay?
Sure.
We have a little bit more flexibility in our schedule, so I do book an hour and a half per patient so that I can perform these standard of care screenings for everybody.
And you get a free head massage.
And you know what? That's one of the most things that people say. So
it's awesome.
We check for lumps and bumps. We check your lymph nodes.
Okay.
Yeah, so I'm checking your lymph nodes under here.
Yeah.
And then I check your thyroid region, making sure that there's no enlarged thyroid.
Okay.
And anytime if we do find anything suspicious, we will write a referral either to an oral surgeon or to your medical doctor as well.
Gotcha.
There we go. And I'm going to get you to open and close for me. There we go. No pain, clicking, or popping?
Nope.
Perfect. So I'm just going to change my gloves, and we're going to go ahead and we're going to do the intraoral examination.
Okay.
Safety first. So
of course.
You got to wear your glasses.
Oh, well, hey, man, I like the shades. This is one of the best things of the dentist. Now they have, you just get to sit back and pretend you're in Cuba, you know?
Relax.
Get to relax under the lights.
You need that little side holder for your margarita. Okay, so when we do an intraoral exam, I'm going to go ahead, I'm going to check all the lips.
Okay.
And I'm going to get you to slightly open for me, Derick. You just keep that tongue in there just right now. So taking a look around, making sure that everything's okay. I'm going to turn my little light on here.
Okay.
Okay.
How's it look?
It's looking good. So far, so good. Okay, so I'm just going to use this mirror. This was a clean, disposable mirror, and then I'm going to give it to you after so that you'll be able to perform your oral cancer screening on yourself. Did you know these little bumps down here, these are called tori. These are completely normal.
Okay.
I check your palate, and then I'm going to go all the way back here, and can you say, ah? Good. Everything looks good back there?
Right on.
Now let's check your tongue.
Okay.
So
We got 30 seconds left, Shannon.
Okay, well, let's do it fast.
Okay.
Stick that tongue out for me. Gonna wrap it in a little blanket. We'll check each sides here. I don't see any lesions, and then you may have it back.
Nice.
There you go.
Look at that. Shannon Maitland, everybody. Farmers Market, what's the date again?
May 11th.
May 11th.
May 11th.
And you have a chance to win this amazing water pick and get a free cancer screening for yourself. We'll be back with more daytime right after this. This is a first for me on television, and I've done a lot of stuff. It's amazing.